Hello, my name is Maya Kraft and welcome to the PowerPoint presentation for Malignant Hyperthermia, the cool approach to a burning problem. This project included a development of an online educational activity through Zuno. It was a web quest that included a pre-test and a post-test, and modules that covered the condition, the pathophysiology and etiology, the classic clinical signs, and the emergent management steps during the crisis in the operating room. The staff previously participated in PowerPoint presentations regarding the malignant hyperthermia condition, pathophysiology, signs, and the treatment, but never had a hands-on exercise that would pull together the didactic knowledge with the clinical skills required to manage this crisis appropriately. This created an opportunity for improvement. The stakeholders that were affected by this project were the patients, as well as the operating room staff, which included the registered nurses, surgical technicians, anesthesia staff, and the ancillary staff, as well as the healthcare organization and administration, which included the OR manager and the supervisor, as well as the nursing education department and the pharmacy. All of the stakeholders had their roles that they had to fulfill in order to make this project a success. The operating room staff and the management had to participate in the online educational component and then come and participate during the simulation that was done 3 weeks after the web quest was distributed to the staff. This project was designed to teach different health professionals with different levels of educational backgrounds and experience that are working within the same department. Although numerous theories could have been applied here, the author chose adult learning theory developed by Malcolm Knowles in the 1980s and Patricia Benner's nursing theory, which is based on Dreyfus's model of skill acquisition. The adult theory applies here because all the members of the staff are adults, and the Patricia Benner's nursing theory applies because the collective level of education and the amount of experience varies in this department. Adult learning theory revolves around basic assumptions about adult learners, that they are self-directed, they have prior experiences on which they rely on as a resource, and they have to have a perceived usefulness for the information that is being presented, and it can be applied in their professional career. As nurses, we are all aware of the Patricia Benner's nursing theory and how it applies to how a nurse will be identified based on a scale from a novice to an expert. In this department, individuals varied in their experience and education. Collectively, because the malignant hypothermia is such a rare condition, most professionals, even with 30 years of experience, may have never been involved in such a crisis. That's why this project was so important for all the members of the operating team to participate in. There are numerous resources available that can be utilized for a project such as this. However, evidence-based research has to be applied in this instant, and Malignant Hyperthermia Association of the United States, or MHOUSE, reviews data and conducts research and education about malignant hyperthermia and related conditions, and most importantly, it provides recommendations on the proper treatment of a malignant hyperthermia crisis in an operating room. The American Association of Nurse Anesthetists, the Association of Perioperative Registered Nurses, and Association of Surgical Technologists, also listed under the evidence-based, all agree that the best way to be prepared for this crisis is to follow the MHouse recommendations and practice the skills, educate annually, and utilize simulation as a means of testing the skills and making sure that the staff is prepared for management of this crisis in the operating room. Leadership strategies that were displayed throughout the project included being a patient advocate, displaying ethical behavior and applying it in a practice, interprofessional communication and collaboration, policy review, making the project patient-centered, commitment to excellence, and strong problem-solving skills. The outcomes that were identified in the project stated that by the end of the learning activity, learners will be able to identify signs of an impending MH crisis, exemplify behaviors of a cohesive and collaborative interprofessional team, synthesize theoretical knowledge from online WebQuest into practical knowledge during a simulation, and provide an essential blueprint for the development and implementation of future MH simulations. There were numerous criteria for the evaluation of the outcomes, and that the outcomes were achieved. They were the test scores analysis, observation of the team during the simulation, simulation evaluation rubric, opportunities for improvement that were identified during the debriefing, a course evaluation, and an annual competency. The first evaluation criteria that shows an achievement of the outcomes is the analysis of a pre-test and post-test scores. This graph displays the improvement, which is overall 16% average improvement in the class score. The red identifies the pre-test scores, and the blue identifies the post-test scores. What's of interest here is that certain individuals actually lowered their scores in the post-test. The further evaluation criteria were the analytical rubric, which described the key components that the team had to display and were observed during the simulation. And those were identified in the Malignant Hyperthermia Crisis Simulation rubric developed by the project facilitator. The key components that were observed were the identification of triggering agents, identification of clinical signs, effective response of the team, and team communication and resource utilization. And during the debriefing, all staff participated in this, including the participants of the actual simulation and the observers of the simulation. The staff were able to identify numerous opportunities for improvement. One of them was that there was a need for this education to occur annually, including simulations. The organization did not have a malignant hyperthermia treatment policy in place. The pharmacy did not provide the appropriate supplies for the MH cart, and the lack of an MH cart, the supplies for the MH crisis were scattered throughout the operating room department, and some of them had to be obtained from post-anesthesia care unit, which is actually locked after hours. The course evaluation survey was handed out at the beginning of the simulation exercise and collected at the end of the simulation exercise. And it asked questions regarding online content quality, the simulation quality and effectiveness, and the effectiveness of the project facilitator. The overall benefits of this project include improved knowledge and response of the team during a simulated MH crisis, knowledge synthesis between the web quest and applying that knowledge into the simulation, and crisis preparedness analysis, which occurred during the debriefing, which identified some improvements that had to happen in order for the OR to be fully prepared should the MH crisis occur. 36 members attended the simulation exercise and 26 completed the survey. The feedback was greatly positive, with the overwhelming majority of staff marking agree and strongly agree on all the statements provided on the survey. The self-rating of knowledge before and after scale, 16 marked an improved knowledge level after the course, and on a question if this course should be part of an annual competency, 19 individuals indicated that yes, it should be an annual competency. The project has a huge significance for the organization as a whole, but especially to the operating room, the pharmacy department, and the nursing education department. It is important for the operating room because the staff agreed that they lacked the knowledge and the hands-on skills in order to effectively manage a MH crisis should it occur, and the management also agreed with that assessment and decided that the education should occur annually and include mini simulations to effectively prepare the staff for management of this crisis. This is important for the pharmacy as well. They will have to work closely with the operating room staff and the management to assure that they provide the appropriate supplies, especially the 2-liter bag of sterile water that will have to be removed from the operating room and be replaced with 100 cc sterile water vials. This was a M-House recommendation. They state that in an emergency, the bag could potentially be hung up and infused into the patient, which would create more issues for the patient. The nursing education department, this is important for them because they will be asked to be included and participate in the development of further education and the mini simulations for the operating room staff. This project could not be a success without utilizing nursing judgment. From the project conception to its completion, all standards of practice and professional performance were incorporated into the project, including the nursing judgment. And nursing judgment is essential in assessing the progress of the project, assuring that everything is rolled out on time, allowing enough time for the staff to complete the web quest, allowing enough time to develop the simulation and the simulation evaluation rubric, as well as collecting all the supplies necessary for the simulation. Another part of nursing judgment is overcoming challenges, being able to work through the challenges and find the plan B. The web quest was initially going to be put out through the internal educational program. However, that program was very cumbersome to use, so the author decided that it would be better if the web quest was shared as it is. This led to another issue, which was that the staff were not following the directions included in the email with the web quest link. Working with different professionals requires nursing judgment as well. There's many professionals that work in the operating room. They are different ethnic, cultural backgrounds with different educational levels as well as experience levels. Using the technologies is also a nursing judgment, making sure that the correct technologies are utilized for the appropriate with the appropriate educational components. In this case, the WebQuest was used, as well as simulation, which didn't require technology. However, the PowerPoint that was running along with the simulation that had all the steps delineated in it required a computer and IT knowledge in order for it to be presented to the staff during the simulation. This project is significant to nursing, and it supports the excellence in nursing practice because it shows that as a nurse you can find things to improve within the practice that you're performing in a department. If something isn't right, you can question it, you can develop the education, and you can share that education with those that you work with. Globally, this project could be shared with different facilities, as well as different departments within the organization where the project took place. Malignant hyperthermia doesn't occur only in the operating room. It can be triggered by other things besides the anesthesia gases and succinylcholine. There's other conditions that are related to malignant hyperthermia but have different etiologies. And malignant hyperthermia does not discriminate, and neither should the team that is taking care of the patient that is experiencing this crisis. This project provided the opportunity for diverse staff to interact, analyze the process, and seek improvement from each other. During the briefing, it was noted that the staff collectively agreed on numerous improvements. Things from surgical technicians were taken into consideration, just as things from the chief of anesthesia were taken into consideration equally. This project also displayed the changing role of the project's author. It required the author to work with different disciplines, different management, pharmacy, and nursing educators, and examining own role, changing from a simple co-worker to an educator, accepting the role of the leader and the change agent, and embracing those roles led to the project's success. Accepting the role of a change leader requires one to identify shortcomings in the process or the way things are done, and being the motivator for the change, for the betterment, and contributing to improved patient outcomes. This project was the culmination of the graduate journey that provided guidance in professionalism, leadership, effective communication and collaboration, as well as problem solving throughout the different courses. These skills were instrumental in developing and implementing of this project. This project allowed the author to step out of the comfort zone of a student into a new role as an educator and an agent of change. It reinforced author's spirit of inquiry and demonstrated creativity, innovation, and commitment to lifelong learning. The following are just a few of the most important references utilized throughout this project. As you can see, most of them are within the last 5 years. And finally, thank you for your attention and good luck in your future endeavors, everyone.